so worried. Oh. Ugh. She's not a good makeout candidate.
Not at all. Who's this?
This is Olive.
You know the name?
I totally know the name this time. She's my buddy's. She's the cutest little chihuahua bean, and she's very nervous. She's a nervous farter. Hello, Olive. Hello. Let me just take a look at her teeth. Okay. She's got a little bit of tartar. Okay, they're not too bad though. A little bit of gingivitis up here too. Oh. Oh, good girl. She's so nervous she doesn't even know.
All right, what was that we just gave her?
We gave her some Cerenia. It's a anti-nausea, anti-emetic drug.
Correct. Anti-emetic is a big fancy word that means don't vomit. Sometimes they throw up because of the medication, and because they're sedate, they don't swallow very well, and then they get it down into their lungs and they get pneumonia. So we give them a little injection to help stop that.
Here we go.
So we got the blood work back, and we do have one little abnormality here, and this is a liver value, and it's mildly to moderately elevated. Won't change anything as far as the anesthetic goes. I don't think that'll be a problem, and it very well may be due to the teeth being a little infected. Sometimes that'll cause that liver enzyme to go up a little bit. We might hold off on the Rimadyl. I'm still on the fence about that because I like the anti-inflammatory, but that can have some negative effects on the liver, so I probably won't use that. But it's going to change things. So this is why we do the blood work, because every once in a while, even on a very young animal, you find something a little bit abnormal and it changes something you do.
We are giving propofol. This is what we're going to use to get her into a nice sleepy state so that I can intubate her.
So completely knock her out. There we go. Count backwards from 10, 9, 10. She's gonna check the seal. So she checks it to make sure there's not any gas escaping, so there's no fluid going down. So this is what Ginger usually does. She does the probing for us, and she'll come and tell me if there's anything specific. Yeah, right.
A bit of gum recession there, but we'll clean it up. This is a little bit of overlapping.
Is that back one look?
Yeah, I don't know. We'll see when it's a little bit loose.
It's
So
loose.
that one.
Probably lose that one.
Yeah.
What about that third premolar? What do you think?
It's okay.
Maybe?
But we'll see.
So we're checking the multiple sides of the teeth, right? So they also have their lingual side as well as their buccal
These are
side.
not too bad, actually.
That is the lingual side.
But
It's gonna beep at us.
oh yeah, that's nice and loose right
yep.
there too. So that will be very
loose that one is.
very easy to take
Probably that one. That could be what was causing a lot of the bad breath. In most cases, what happens is Ginger does the exam and does all the probing of the teeth just like she did there, and then she'll come and tell me, or I'll be standing there in this case, and she'll say, oh, these are the findings that we have for this particular case, and then we'll talk about what to do.
They clean up nicely. Antibiotic just to take care of any infections that might be brewing. I'm sectioning this loose tooth just to make it a little bit easier to extract. The good thing is that the roots are on here, so
Yes.
that's an important thing when you're removing teeth.
Yes, but you can see where the bad one was for
Yes,
sure.
definitely.
Yeah.
Coming out.
Good, and that's the other half.
Mm-hmm.
So you can see there's a hole back there, and then we'll stitch it up.
The tartar P4. And this one's really loose, so that one will come out really easily. A little bit of tartar right there still. This is polishing the teeth after scaling just to smooth out any grooves that were left in the teeth from the scaling. The bacteria can grow in the grooves if you don't smooth it out. And then we're gonna put on a little fluoride.
Ooh. Looks like they have rabies. Oh, she's coming around.
So Olive's going home now, so we're gonna go talk to her parents and discharge her.
Thanks for watching, everyone. I hope you enjoyed seeing what happens when we do a dental from beginning to end. Freeze frame high five.